Welcome to Clinical Cousins YouTube channel, where today we're going to go over the drug Spironolactone, also known as Aldactone. This drug is classified as an aldosterone antagonist. What I want you to remember though is that it is a potassium sparing diuretic. You should remember that this drug is given for hyperaldosteronism, edema, hypokalemia, hypertension, and congestive heart failure. It cannot, or should not rather, be given to patients who have hyperkalemia, hypotension, or severe renal impairment because it will make these conditions worse. In pregnant women, this drug is possibly teratogenic, so use caution in 2 forms of birth control. We should know that this drug binds to and blocks our aldosterone revolving door. Simply put, we should know that our nephron has a section called the distal convoluted tubule, and normally the cells in this section are involved with sodium and potassium and water regulation. Now, our cell has a blood-facing side and a urine-facing side. On the blood-facing side, it has our favorite sodium-potassium ATPase, and on the urine side, it has our sodium and potassium revolving doors, as I call them. Now, usually, aldosterone is secreted by our zona glomerulosa, or the top one, in our adrenal cortex into our blood, where it enters our cells and onto aldosterone receptors. The aldosterone will tell our cells to produce more of these sodium-potassium revolving doors. Usually, when positive sodium and water reach our late DCT cells, it enters the sodium channel and goes into our cell. Now, this positive sodium will make our cell more positive in this area. This pushes the positive potassium out of the cell and into the urine, where it will be lost via urination. This is why I call it a revolving door. Sodium is taken in and positive potassium is pushed out. When we give a drug like spironolactone, it will block our aldosterone receptors in our cell. This means that there will be no revolving doors that are made. It means that sodium will stay outside in the urine and potassium will be kept inside or spared, where it will enter our blood. Now, what has just happened? We have just lost some sodium and water into our urine, and we have retained or spared some potassium in our blood. Now, because you are a great healthcare professional, you will also be aware that this drug can cause reversible gynecomastia, also known as man boobs. And you may see some of your classmates or other young girls using it off-label for acne. We should know that this drug has an onset of about 3 hours, and it will have effects that last for about 3 days. The side effects of this drug may include hyperkalemia, right, because we're retaining potassium, hypotension, because we're urinating more, dizziness, headache related to fluid loss, confusion, gynecomastia, and leg cramps due to electrolyte imbalances. Some commonly tested material about this drug is that it is a potassium sparing or potassium retaining diuretic. It can cause hyperkalemia, potassium in the blood. It will cause polyuria or excessive urination. And also be sure to monitor your patient's kidney function and patient's blood volume depletion. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.